Hi, hello everyone, and welcome to the second in our series of Doctors for Good Health. First of all, I do want to tell you that I'm hardly able to. The response to yesterday's session has left everyone in my team absolutely overwhelmed. And even today, the minute we put in Dr. Lim's story that he is going to be live, we have had more than 150 responses or more than 150 questions to him. Well, as a lot of you know, that he works out of Parkway Hospitals in Singapore, and for all queries related to your liver, he's the person that you need to be talking to. I'm going to have him online really soon. And Dr. Lim, even before you come on, I want to say a very, very big thank you, because I do know that this is Christmas time. I also know that you're going to be having a Christmas party with your team very shortly, that you've been in procedures all morning. And thank you very much for making this time and joining us. I truly appreciate this, and I'm sure that a lot of us will be able to put the advice that you have for us to good use. I have now sent you the request, and I do hope that you have received it, so that we can start going live with you really soon. So when you see my request, please accept it. For all those of you who want to know, will this session be saved? The answer is yes. Good morning, good afternoon, doctor. Thank you very much for joining us. How are you today?
Hi, Rujuta. Good afternoon.
Hi. Good afternoon. Thank you. I was just telling them that you've been in procedures all morning, and yet you have taken this time out to be with us. We really appreciate this, doc. Well, I think we are having a few network issues, but I'm sure that they will be resolved really soon. Not able to hear you, not yet. Yes,
How's
now
this?
you're
I'm
live.
back. Okay. How's the connection
Yes,
now?
you are.
Better?
Absolutely good. Yes,
Okay,
yes.
great.
It's good.
Nice
It's
to see
good.
you again.
Nice to see you too.
Thank you
Nice to
for
see you
inviting
too.
me.
Thank you very much for accepting the invite. I do know that you've been in procedures all morning. I also know that your team is probably waiting on you to just finish this, so that you guys can finally have your Christmas
Oh,
party, a bit of
that's
easy
not
time
till
for
much
all of you.
later. Not too much later. There's more work for me to do after this.
Oh, okay. Then thank you all the more for taking the time out to be here with us. We have more than 1,000 people watching us right now, and the numbers are steadily climbing. I want to dive straight into questions, and I want to ask you that, you know, tell us, what is it that we should, as lay people, know about the liver? We all do know that the kidney maybe functions as a filtration unit, but what is it about the liver that we ought to know, and we are probably just completely unaware of it?
Right. So the liver, I think a good way to describe it is really like the workhorse and a factory that goes on 24 hours. So it's got multiple roles. Um,
Mm.
So, for example, it is like a quality control center. It is a filter, as you put it, as well as it manufactures a lot of important cells and molecules. So, I'll give you a few examples and give your listeners a few examples. Um,
Mm.
Firstly, it makes important proteins. A very important protein, which I'm sure everyone has heard of, is something called albumin.
Mm.
Albumin has many roles, and one of which is also an immune function. So it helps us with our immunity. It helps us to bind certain molecules together, and
Mm-hmm.
it helps to also produce antibodies. Again, it's all tied in with immunity. The
Mm.
liver produces clotting factors, and that's what helps. to make our blood maintain this, I guess, certain viscosity in health. And I think a very important role, which I think many people are aware of, it has a role in detoxifying certain toxins. And this can be in a form of medications, in terms of, I guess, natural toxins, for example, a classic example is alcohol. So the medications that are freely available over the counter, paracetamol, these things all need to be broken down, because in certain levels, or when the liver is not functioning the way it should be, these potentially very harmless things which we take for granted can build up to toxic levels. And that can have a significant impact on health and in the body.
Wow, wow. That's a lot of work for the liver, isn't it?
Yes, it is.
Yeah.
And one more point, if I may, is that the liver, even though it's a very hardworking organ, it's also a very forgiving organ. And it has the capacity to repair itself and regenerate. And I think most people know about this in a certain way, because they all have heard about living donation transplants. So when a liver is very healthy, if you hit it a few times, or in the extreme form, if you remove a part of the liver, 30% of the liver, in a very healthy liver, it can regenerate and grow back to normal size, and it can have normal liver function. And we see this live in front of us in all our donors who donate half their livers to their parents, their spouse, their loved ones. 2 months down the road, when you do a scan, the liver is back to normal size.
Wow, that's wonderful.
Another miracle of life.
Wonderful.
Yeah.
Absolutely, absolutely. And thank you so much for sharing that with us, because it is something that one was completely unaware of. Like, it goes back to normal size. That's really good to know. And it's really nice to think of the liver as someone who's like hardworking and forgiving, but that doesn't mean that we should be really abusing our livers, which really brings me to my second question, which is like, why do you think that liver diseases are on the rise? Are they on the rise because of our lifestyles, or do they seem to be on the rise because of better medical intervention at an early stage? Which one do you think it is?
I think you're right on both counts. I think certainly there's greater awareness as information and the internet age makes information so freely available. And I think with countries developing, people are also more aware, and they're more interested in their health. And I think the shift that I have certainly seen in the last 20 or 30 years is that people are now more focused on prevention than waiting for something bad to happen. And I think that's definitely the way forward. So information is out there. People are more interested. They're looking to find more about how to stay healthy, not just what to do when they fall sick. At the same time, I think in parallel with more information and more interest is that certainly certain liver diseases we can see, and this is a global phenomenon, not just in Asia, in India, in Singapore. Conditions such as fatty liver disease, it is the fastest rising liver condition, as opposed to certain conditions like viral hepatitis, like hepatitis B and C, because they are very good medications, antivirals now, and these viruses can be suppressed and even cured in the case of hepatitis C in a very short space of time. However, certain conditions like fatty liver, that runs a parallel course with a lot of metabolic and lifestyle factors. So as people now do not suffer from malnutrition, most people suffer from overnutrition now. And there's more diabetes, there's more hypertension, there's more high cholesterol. The incidence of fatty liver is going up. And that's a global phenomenon and a global trend.
Wow, I've been seeing like a whole lot of children as young as 8 and 9 being detected with fatty liver, and then it really freaks out their parents. The parents worry that this means that it's going to be diabetes in the future. They're not even sure if it means like a normal age span for their little children. Why do you think that fatty liver is on the rise with kids as little as 8 or 10? what can parents do to prevent that? And, what should parents of children with fatty liver be aware of? Because most of them get detected with fatty liver of grade 1 or 2. What is it that they should really know?
Right. So that's a very good question. And I think, well, number one is don't panic, because it's at an early stage, if you say stage 1 or at early disease, it's reversible. And the
Oh,
things that we
that's
need to
nice.
do to reverse that are uh, actually, it sounds easier than it is, I guess, right? But it's having a healthy lifestyle, it's having a good diet, listening to your dietary advice.
Oh, thank you,
It's
Doc.
doing a regular exercise. And I think in general, if you talk to a cardiologist, you talk to a renal physician, most of them will say the same
Right.
tune will sort of echo, because there is
Mm.
no doubt that having a healthy, sustainable lifestyle and diet together with regular monitoring, that is the
Mm-hmm.
cornerstone to good health and to preventive health. So for parents whose children have been found to have fatty liver, I think a lot of it is sort of twofold. Number one is the amount of calories that we put in and the type of food that we eat, as well as the lifestyle. So a sedentary lifestyle, not having enough physical activity, all that comes into play. So I think the simple measures need to actually start at home in the dinner table. Um, get some fresh air, walk about. Of course, these things need to be done with a bit of caution at times of a global pandemic.
Oh,
Take the stairs, not the escalator or the lift. Simple things like that. I try to do that in the hospital, mainly because I'm too impatient to wait for the lifts. So I always take the stairs. And lifts at peak hours drive me crazy because it takes too long. So I take the stairs. And simple things like that, which is, I guess, it's a habit that we want to try and cultivate.
oh,
And
that's wonderful.
yeah. And certainly you're absolutely right. The global statistics show that fatty liver incidence is also on the rise in teenagers. And this is
Yep.
seen both in developed countries as well as
Mm-hmm.
developing countries. So it's a global phenomenon.
It's a global phenomenon, yeah. Because I was going to ask you that do you see it on a bigger rise in the developing countries like maybe India and Brazil and China, or do you think it's more like a global trend?
I think it's a global trend. There are some publications from China which show that it's happening in the young. I've
Yeah.
not seen any recent ones. I'm sure they exist. I've just not maybe not come across it. Any publications from India looking at the younger population, but I will not be
Mm-hmm.
surprised at all that it is a global phenomenon.
All right. So, especially when we're talking about the younger population, do you think exercise and activity should be an absolute must for them? And, should parents or even adults who have fatty liver kind of ensure that they're able to spare time and make time for exercise at least like an hour a day? Should parents maybe prioritize sports and activity over homework for children? And
Yeah.
how do you think the lockdown is going to affect liver health in the long term, because we are really moving much lesser than what we used to?
Yeah, that's a great question, and it is. I'll try to answer that. It's a difficult question to answer, so I'll split it into a few parts. Well, firstly, I think your first question about activity and exercise, resounding yes, 101%. This has been
Hmm.
borne out in many studies, and just to stay on the example, the topic of fatty liver, it's been shown that if someone with fatty liver and this fatty liver, as some of you may know, is a spectrum. You go from simple steatosis, which is just fat accumulation in the liver, to
Hmm.
steatohepatitis, meaning there's inflammation of the liver cells. And then that over time may result in scar tissue forming called fibrosis. Liver fibrosis then leads to cirrhosis. So it's a spectrum. And by losing 5% of body weight,
Hmm.
takes away and normalizes the amount of inflammation and fat. If you lose 10% of your body weight, the improvement is even better. Some of that scarring can resolve.
Oh,
So
that's
it's
awesome.
easier than it sounds, I'm sure. Losing 10% is not easy. It's not losing it, it's maintaining it as well. And the last session that we had together, Rajita, remember we said sustainability is key. So
Absolutely.
yeah. So
Yeah,
that
yeah.
it's a resounding yes for physical activity, regular exercise. No doubt about it. And the scientific studies prove it as well.
Yes, yes. Oh, which is what I loved about our last session together, that you laid so much emphasis on sustainability, that you were completely on board that diets need to be sustainable. Do you think that extreme diets can mess up with your liver enzymes? And would you like to caution about that?
Yes, absolutely. Again, this is shown in scientific papers and in clinical practice. So people who go on these, rather extreme crash diets, and there's so many of, I guess, how do I say it politically correctly, fashionable diets that may not be
True.
sustainable for more than a very, for a long time. We see in a hospital setting in people who have suddenly become very ill and they need artificial feeding. We actually see rises in the liver enzymes. They can actually develop steatosis or fatty liver very quickly, paradoxically. So I
Wow.
think anything done, in moderation and that's sustainable cannot be bad. And that's the way to go, I think. Anything that's sort of extreme at both ends of the spectrum, number one, it's not sustainable. Number two, it may have a rebound, a paradoxical effect on the things that we're trying to actually treat and improve. So yeah,
Right.
I'm totally on board with you that it's got to be sustainable and baby steps. Yeah.
Yes, I think we need to remember that, because for most people, no one's interested in losing 10% of body weight. They want to just lose all of that body weight. And this is the season to lose all of that body weight to fit into that tiny black dress for New Year's, maybe, or, at the virtual party that everyone's going to be having. But yes, you're right. It's baby steps, right? It's not about being fit for the new year. It's also about staying fit even when it's 2031, you know?
Yes,
Yeah.
absolutely.
Do you see one gender being affected more than the other as far as liver malfunction goes? Are more women prone to it as compared to men, or, is it the other way around?
I think it's the other way around. Unfortunately, I mean, the men have the shorter end of the stick in more ways than one. But when it comes to liver disease and liver health, men have more high incidence of liver cancer, liver cirrhosis, liver-related death. So I
Oh,
guess it comes down to the fact that I guess women know how to look after themselves better than we do. But there are certain conditions where the gender difference is reversed, and fatty liver is one of them. Because there is also studies have shown us that there is perhaps a hormonal influence on fatty liver as well. When it comes to alcohol, if you have a man and a woman drink the same amount over a long period of time, the female patient is at higher risk of developing more severe liver disease than the male patient. So while more men drink compared to women, women are actually at increased risk if they drank the same amount for the same duration of time. So that's the sort of subtle differences. But if you look at big picture, the statistics for the men are terrible.
oh. Okay, okay. But this is really interesting to know that maybe we are more prone to fatty liver as compared to men, at least at the same quantity of alcohol. But when it comes to more complications, I think it's
Yes.
men seem to be much more vulnerable to them as compared to women. As a layperson, does liver disease cause any kind of symptoms? Is there something that I should be watching out for on a day-to-day basis? Will I know that my liver is not functioning optimally?
Yeah. So that's another very good question. So the scary part is in early disease, and sometimes even in some advanced cases, the patient feels absolutely fine. And I've seen patients in my daily practice, they may have liver cirrhosis, they actually have a liver cancer in there, they have normal liver function tests. They feel
Oh.
absolutely fine. They're still working, they're functioning, firing on all cylinders. And it's because of a certain tumor marker or a friend that says, hey, you better get yourself checked up. You're hitting 50 soon. And they go for all this screening tests, and then they find something. On the other hand, symptoms are quite common in patients who have advanced liver disease. So if you have early disease, it's more likely that the patient feels absolutely fine. The more advanced the liver disease, the more likely he or she will feel unwell. And it brings back to your very first question about what are the roles of the liver, the functions of the liver. So you imagine those are the things that the liver does in health. So if the liver is sick, it will not produce enough albumin, and therefore all the immunity goes down, and the clotting factors go down, the detoxification processes go down. So patients with decompensated liver disease, they are more prone to infection. They have low albumin, and therefore they get fluid retention. They get puffy feet, swollen ankles, fluid accumulating in their abdomen. They have clotting, bleeding issues. They have very thin, the skin can bruise very easily. And simple medications, which we, again, take for granted, paracetamol. They can take normal levels of paracetamol, but they may not be able to metabolize it at what they used to, a healthy liver can do. And therefore, some of the levels can become a dangerous or a toxic range. So these are the things which can happen in somebody with an unhealthy liver.
Wow. In our session together the last time, you also spoke about lean NASH, which I thought was really interesting, because most times we worry about overall metabolic health only when we are obese or when we are at a high BMI. But, like the way we were discussing last time, you said that, you could even like thin people could have a liver issue too. So what's lean NASH, and, what can one do about it?
So fatty liver NASH spectrum normally is associated with the metabolic syndrome. So people who are generally overweight or obese, they have high cholesterol, they have central obesity, adiposity, and that is the typical phenotype or characteristic of patients with fatty liver. And so it's so closely linked with the metabolic syndrome. There's a movement now to rename NAFLD, non-alcoholic fatty liver disease, because there's a stigma with the word alcohol in there, to MAFLD, MAFLD, and that is metabolic associated fatty liver disease. And many people regard fatty liver as the sixth hallmark of the metabolic syndrome. So that's the classical, clinical characteristics of somebody with fatty liver. But now that more studies and there's so much interest worldwide in fatty liver, we actually now see that even people with a normal BMI can get a fatty liver. And these, it threw the whole thing into a bit of a disarray to say, how can thin people have fatty liver? And fatty liver is actually much more complicated than what we initially thought. And there are so many things interplaying. There are certainly genetic factors. There are certainly environmental dietary factors. There are certainly medications that can cause it. So many things now, as we learn more research is coming through, there are many factors that can affect this, not just being overweight and having high cholesterol. The challenge is that how can you tell somebody with a BMI of 20 to lose 10% of their body weight? So the theory then, again, the issue then is you still encourage them to be active, because going for a brisk walk, a jog, a run, a swim, lifting some weights, all that strength training. Also, when muscles are active and contracting, they need energy, and they will burn fat. And that fat can come from subcutaneous fat under your skin, as well as the visceral fat in organs like the liver. So again, while the targets may not be the same, having enough physical activity and having that exercise that burn certainly will help in patients who have a normal BMI with a fatty liver.
Good. Thank you. That was really very, very interesting and informative. Before I start taking questions from the ones that we've received for you on that Insta Live, I want to ask you, what are your plans for Christmas, and how do you plan to unwind? Because I know that day in and day out, you're dealing with people's liver health, and liver is something, I guess, when someone's affected with poor liver function, it takes a toll not just on the person who's affected, but also on their families. So what would you like to say about that? Have you seen families suffer because of one of their loved ones having poor health with their liver, and how do you manage to unwind through everything that you do on a daily basis?
That's a tough question, but certainly the first part is yes. And some of the patients that and cases that I see are truly heartbreaking, and I've seen young patients. And when I say young, I'm talking 40s, 50s, because nowadays people live to their 90. So people in their 40s and 50s with advanced liver disease, advanced cancer. And some of them, they have young children in primary school. Some of them are waiting to start a family. They just got married, and they need a transplant. And sometimes there is no transplant, or the transplant cannot occur in time. And some of them, I followed through to the end, and it is heartbreaking, and it's difficult to not get too attached. And after a while, we treat patients like your own family, and I think
Yes.
if we do that, we tend to often make the right choices. But sometimes it's difficult, especially when we see modern medicine not being able to save them. It's tough, and hopefully with more public education, more knowledge, people will come forward earlier on when medicine and technology still can make a difference. When someone presents with very advanced disease, they're jaundiced, they're in a coma, that's a 10-centimeter tumor in the liver. Unfortunately, even the best medicines that we have will not be able to extend life. And at that point, I think it's really about quality time with the family, and that's I think the objectives of care will change depending on the status. So yeah, I mean, end of the year is a time for being with family and having a good time. But I think there are patients out there who will not be able to do that. So we still have to come to work at Christmas and New Year's Eve to look after them.
Yes. Oh, wow, wow. That's solid commitment. That is solid commitment that you have there. Is it okay if I take a couple of questions from
Yes, of course,
the live? Okay, yeah.
of course, yeah.
So one of them is about, what's the relationship between high triglycerides and liver health? If I have high triglycerides, am I likely to have liver disease in the future?
I think in general, high cholesterol, be it LDL or triglycerides, that will put you at
Mm-hmm.
higher risk of developing fatty liver.
Mm-hmm.
I think usually when people have their health screening done, if they have high triglycerides or high LDL, I'm sure that the doctor that ordered those tests would have also ordered a liver function for you. And especially if your liver enzymes are also a little bit elevated, I would suggest that you, or if it's not already done, to get a simple ultrasound of the liver. And that will give
Okay.
us some clues as to whether truly there's fatty liver, or there's any other findings which may need to be acted upon more urgently.
Mm-hmm. All right. Since you also said that the liver plays a role in immunity and in building antibodies, um, you know, how do you think the whole coronavirus situation is going to, I mean, what's the relationship between a new virus and our liver? Can it
Yeah.
just make antibodies on its own? I mean, how does that work?
So the again, very topical question. There's been a few publications on that, and I did one paper together with some of my colleagues in Singapore, mainly to see
Mm-hmm.
how the COVID-19 virus affects patients with liver disease. So we do see from the data that's available, both from US, Europe, and in Asia, patients with COVID-19, we do actually see a rise in the liver enzymes. However, we think that's not a direct effect. So take, for example, a parallel to that is, say, for example, dengue fever, which is very common in Asia.
Yeah.
Patients who have dengue fever also, we see a rise in the liver function, but that's transient and it comes down. The
Mm.
other reason we think there's a blip in the liver test is because of some of the medications that doctors and hospitals around the world have been using in the more severe cases. Those have also been known to cause a rise in the liver test.
Oh.
Whether or not you can bounce back from COVID infection if you are, if you have contracted it, Based on your liver health, I don't think there's a direct correlation. But certainly, the more medical problems you have, if you are diabetic, you have heart disease, you have chronic illness, and you have liver cirrhosis, chances are you may have a more serious cause of COVID-19 than somebody, say, a fit 21-year-old with no medical disease. So I think that is the indirect link with liver health, immunity, and overall response to how well we can fight a viral infection like COVID. But I don't think that it means that if you have a healthy liver, you'll be unscathed. I don't think anybody is protected from COVID until we all beat it together, the whole world over, because we're so closely connected now. The world is so small.
Absolutely. Absolutely. Yes. Yeah. Yes, that's true. Well, there is one more question for you. How does one cleanse one's liver? Is there anything like that? Can you clean up your own liver?
So, good question again. I've been asked this many times. I think if you do an internet search, no matter where in the world you are, you will find many hits on a magic potion, a special program that can make you pure and wholesome again. Yeah, like a newborn, a perfect liver. Again, I think we need to let me phrase this correctly. We need to have a little bit be a bit discerning about what these things are. Because if you think that all these things were the answer and the cure, then after whatever magic potion, nobody will have any form of liver disease anymore, because you'll detoxify everything. You'll cleanse the liver from every single virus, every single toxin. Clearly, that's not the case. We still have a world with people with, liver cirrhosis, liver cancer. So I think be cautious about things which may have been recommended or you read on the internet. There are certain, and I've seen patients myself in Singapore and when I was working in the US and in London, that they have been promised this wonderful outcome. And this magic potion may come in the form of a pill, a solution, a natural juice. And in the end, 2 weeks later or 4 weeks later or 2 months later, the patient's in ICU with liver failure. And when we do the testing to have all that samples analyzed, sometimes it's actually a concoction of all kinds of Western medications.
Wow.
And that actually tipped the patient into liver failure as opposed to doing what it was supposed to do.
Promised. Yeah.
So I think the safest way is, again, baby steps, something sustainable, something simple. Avoid harming the liver by abusing it with too much, alcohol, too much unnecessary medication. I think nowadays, one of the things which I try and do actively in my practice is to actually ask patients what they're actually consuming. And in terms of Western medication, prescription medications, over-the-counter supplements. And I ask them, what are all these for? And half the time they tell me, my friend recommended it. And they're actually not sure why they're taking it. So I think the medications that need to be there need to be taken. Everything else, we need to ask ourselves, is this going to be beneficial or is it potentially harmful? So while we look for this wonderful magic bullet that will detoxify and cleanse us and make our livers totally healthy again, while we get there, I think the main thing is to have a very rational and a very common sense approach to staying healthy.
Wow,
I don't think I answered your question very well, but that's the best
I think, well, I think you absolutely did. You absolutely did. You said it, you said that there is no magic cure out there to really cleanse your liver, that it is baby steps and sustainable and simple things that you do on a daily basis, which will really keep your liver and your body in a good shape. I mean, that was really wonderful. Before I let you go, one last question. I do know that you see a lot of patients from India. Is there something that you would say we need to change in the way we are living our lives so that we have lesser incidences
of liver diseases. You know, anything that you have seen which is maybe could be specific or more common in Indian culture, which needs addressing as far as overall health and liver health goes?
I think there are quite a lot of parallels with the sort of metabolic makeup of uh, people in your country and people in my country. And I think as people get very busy, they tend to not pay so much attention to, again, setting aside time to exercise, setting aside time to have a healthy home cooked meal. People are now, even in COVID and on lockdown, they are Skyping their company, their colleagues around the world with the time difference. They're having suppers at midnight, going to bed at 3 a.m. And they said they're too scared to go to the gym or to the park. We can always have a lot of reasons not to do things, and I think we just need to have a sort of protocol or a habit and try and sustain that. Certainly in Singapore as well, we have a very high incidence of diabetes, and it's one of the highest in the world, and the highest also a very high incidence of chronic kidney disease, and that parallels with things like fatty liver very much in tandem and in parallel. So I think it's similar. The drive for being very busy at work, caring for our kids, multitasking all day long, and putting aside or relegating all these other factors into the background. If I have no time to eat, I'll just skip it and I'll make up for it at dinner or at supper. So I think it's similar, and I try and how I try and connect with my patients to say that I know it's difficult, but we need to try and squeeze out that little bit of time, that little bit of effort to actually do it. Because when we start doing it, we actually see the benefit, both on the labs, on the paper in front of us, as well as how we feel every day. And I one of my mentors, when I was a fellow in the US, I take my hat off to him. He works 13-hour days, and he still has time to exercise. I said, how do you find the time? He says, I read the papers and I have my coffee and I'm on my treadmill or my stationary bike at home 5 a.m.
Wow.
So he does that. I read the news, I'm watching CNN, and I'm actually burning some calories at the same time. So I think, and he was in his 60s. And I said that if someone like that who's so busy can find that extra half an hour, I think all of us should be able to also at least try. So I don't think that the populations are actually very different in both our countries, and there's a lot of overlap. And certainly liver disease is an issue in both our countries.
Well, thank you very much. It was a wonderful session, Dr. Lim, and you really simplified a lot of concepts for us, and I do hope that people put it to good use. They take your advice on taking baby steps and building a more sustainable lifestyle for themselves. And thank you really for spending this time for cautioning us about multitasking and being too busy and not having sparing time for ourselves. And I was wishing you, your family, and everyone in your team a very, very Merry Christmas and a Happy New Year. And thank you.
Thank you very much. Thank you, Rujita, and all of you for joining us today. Thank you so much.
Thank you. Thank you. Everyone now knows where to find Dr. Lim. He's on Instagram though. Thank you, Doctor, for doing this Insta Live session. It's been really useful. Thank you.
Thank you very much, Rujita. See you again soon. Bye-bye.
Yes. Thank you. Bye.
Bye-bye.